and welcome to episode 38 of the Fertility Rewire podcast. Now, as you know, I talk an awful lot about natural fertility, about improving your fertility and preconception care from a mind and body perspective. Now, I do also work with people who are having IVF treatments, whether that be heterosexual couples, same-sex couples. So I really want to get the full perspective across on this podcast because there are reasons why IVF is necessary. Equally, as you know, my viewpoint is that it isn't always necessary, and that particularly here in the UK, I have concerns about it as a first-line treatment. However, it is so vitally important that when people are accessing IVF, they are getting the absolute best care. So I was super excited when I was approached by Dr. Shahin Ghadir from the Southern California Reproductive Center. And we had a fantastic chat about his clinic, about what's happening in Los Angeles, and some wider aspects as well. So I really, really hope that you enjoy the episode. And I think there are some real take homes in terms of assisted conception and also natural conception too, particularly in terms of people starting to think a little bit ahead of the game. All right, I hope you enjoy. Hello and welcome to the Fertility Rewire podcast, a place for information and discussion around topics relevant to fertility. I'm your host, Kat Stevens. I'm a fertility coach and founder of the Fertility Rewire program. And I'm passionate about people being given sufficient information to enhance their own fertility awareness. So I am so excited. It's this evening actually in the UK. It's 8:00 and I am chatting in this episode with Dr. Shahin Ghadir, who is one of the USA's top fertility experts. So we don't have a set plan for this. We're going to see where we go and what we chat about, but I'm sure there's lots we can uncover. So welcome. I'm really pleased that you're here.
Thank you so much for having me, Kat. I've been looking forward to this.
No, you're very, very welcome. We had a bit of a mishap yesterday with the time difference, so we're starting afresh today. My error in the calendar. So tell us a little bit about what you do, Shahin, if that's okay. Can you run us through?
Absolutely, yes. So I'm a fertility specialist, and my title is Reproductive Endocrinology and Infertility Specialist. I work at Southern California Reproductive Center, where I'm one of the partners and have been working here for about 18 years. Fellowship trained in both obstetrics and gynecology and also reproductive medicine. So I think I want to say very well trained in this field. My office is very lucky. We get to partake in the training of the new generation of fertility specialists that are going and coming out. They are the fellows coming from UCLA and Cedars-Sinai Medical Center, and I'm an assistant clinical professor both at UCLA and USC.
Wow. So that's quite a resume. And obviously, I mean, I have listeners from all over the globe on this podcast, and quite a few listeners in the US. But I think something that's hugely of interest possibly to people here in the UK is the differences that we have in the fertility structure, I guess, and the fertility system. So I don't know if you know, here in the UK, people are eligible generally for one funded round of IVF. And then after that, it's to be funded by themselves. So very different to the US medical system, I'm sure.
Yeah, that's great. I mean, to be honest, I think many people would benefit from a free round of IVF here in the United States as well. We either have insurance programs that cover 5 or 6 IVF cycles or 0. Very rarely, we do get people that get a little bit of coverage for 1 cycle, but that's wonderful that everyone gets that. And I've had the pleasure of being in the UK and in London. I think it was Harvey Street with a lot of the fertility centers were, and I met a lot of Harley. And I met a lot of the doctors that are there. I had a prominent friend who's very well known, and she took me around and introduced me. It was interesting to see how incredibly different It is. And we've had a lot of patients come from the UK to the US and to my clinic because of the opportunities of using egg donors and surrogates and a lot of things that are much, much easier to attain.
Yeah. And why would somebody specifically, because it's a hell of a journey, isn't it, to go to the US? So what specifically do you think do you have to offer at your practice?
The use of egg donation is very open. You are able to see pictures of your egg donor, read about the egg donor. In some cases, the egg donors, you can even have, calls with them or a video chat with them.
Wow.
And it is much more open than the rest of the world. In some places, like for example, in Spain, you're on a list and the next time it's your turn, you have no choice who that person is, what they look like, or their ethnicity or anything, to be honest. I mean, I think it's gotten a little bit better over the years, but very, very limited. Here in the United States, you get to pick exactly who you want the person to be your egg donor, as well as to a big extent your sperm donor. And surrogacy is very available and growing rapidly, whereas in many, many countries around the globe, it is very limited and not even legal.
No, true. I had a chat with someone on the podcast recently from Hawaii surrogacy, and we were chatting about the differences because it's all very altruistic here in terms of funding and so on. Definitely.
Well, you really limit the surrogates if you're asking a lot from someone to carry a child for you, and it has to all be altruistic.
Yeah, definitely. Special kind of person can do that, I'm sure.
Yes.
Well, a special kind of person to do it, whether there's payment or not, in fairness, because it's
absolutely. I am 100%. There's a lot of things you can do in the world to make that much money.
Yeah. It's huge. So one of the things that I am passionate about, so I work with people both on the natural fertility side and also if they are going for IVF to support them in terms of what I do. And I noticed when I was looking through your information about your qualifications that you haven't mentioned in psychology, which I think is fantastic to get that mind and body aspect when you're in the fertility system or having any treatments. I think is amazing. How much are you able to use that in the work that you're doing?
I'm a firm believer that the mind is very powerful, especially in fertility patients. And I've had patients that had amazing mindset where they took themselves to the next level and were able to achieve something that I would have called maybe a miracle because of their mindset. And then I have people that do completely the opposite and take themselves down because they don't allow them to go to the place where they need to be in order to succeed. My undergraduate degree in psychology at UCLA, I think really helped me in many ways, but it's that with a combination of my own personality that I think allows me to really put my heart into caring for my patients. And allowing me to be really involved and really caring. And I think when your heart is really into something and you're devoted to helping a couple, magical things can happen versus if you're just doing it because it's your occupation and you just have to do this right now and move on.
No, definitely. And that clearly shines through, you in terms of who you're going to see. You want that relationship and you want...
Absolutely.
I talk about
absolutely.
I talk about with my clients about them getting trust in their bodies, and that is a huge part of it in terms of the mindset and trust, but they've got to have trust in the person they're working with. And at the level that you're doing this, it's so important.
If you don't feel a bond with your team, and I'm saying team because there's a lot of involvement that I have, but a lot of the day-to-day of what my patients are doing involve my team, my ultrasonographers, and also my nurses, IVF coordinators. And luckily, right now, after many years, I have a phenomenal team, absolute phenomenal team. I have a flawless team right now that I'm beyond proud of, that has made a huge difference in our success. And also the satisfaction of our patients. So I'm feeling very fortunate right now.
Yeah. Oh, that's amazing. And you talk about success. So when you look at the national figures, do you have national figures for the states and then you have individual figures for your
Correct.
clinics? How are your figures?
I think we're close to double the success rate of the average clinic in the United States. which is probably around the 40th percent.
Wow.
Our success rate for 2000, and we don't calculate until the year is over, but our success rates for 2019 have ranged every month between 76 to 84.4%.
Wow. And is
And I
that,
think hitting 84% multiple months in a row is actually huge.
cool? And is that for birth, for successful
Pregnancy.
IVF, for
Pregnancy. However, our success rate going to live birth is very similar because 99% of our patients do pre-implantation genetic testing on embryos. So we're almost sure that the embryos are all healthy. Now, I'll be very honest, there are people that have miscarriages even after putting a genetically normal embryo, but the number goes down significantly. So our success to live birth is very high as well. We usually have the analysis done like a year in advance afterwards, actually.
Wow. So that's something in the UK that isn't generally offered unless there is a suspicion that there would be an issue. So if there's a genetic issue within the parents, or if there've been continuous recurrent miscarriages, possibly. So is that pretty much a standard test that you're doing?
About 99% of the patients at my clinic do the genetic testing on all of their embryos that have grown nicely to the blastocyst stage, which for me is huge. As a parent who has been through a miscarriage with my wife and understood the devastation that it caused, and then the significant difficulty we had after conceiving and having to go to IVF, the one reassuring thing I had is that by doing the IVF, we're going to be able to make sure that the embryos that we're proceeding with, that are going to be going into a uterus of a human being, has been tested to the maximum level available.
And one of the things we're talking about, trust, and then one of the issues with IVF is, of course, there isn't certainty, and that's a big thing in the UK because our numbers are much, much lower. So it's, people want certainty, don't they? And I imagine from a psychological aspect as well, that pre-genetic screening gives them a huge sense of improved knowledge, that not certainty, but their hopes are going to be higher. Do you think?
Well, like any place in the world, a lot of our patients are over 35. And it's a known fact that patients over the age of 35 have a significantly higher aneuploidy or abnormality rate of chromosomes. And I don't think anyone's goal is to go through IVF and get pregnant, but with an abnormal pregnancy. Everyone's goal is to have a beautiful, healthy pregnancy and a perfect child when the child is born. So for those reasons, for me, it's very, very confusing to not understand why even clinics here in the United States that have the capability. But I figured, over the years that there are clinics that do have people in their lab, but unfortunately there may not be the most qualified people that know how to do those biopsies well. People have told me, but I don't want to do it because my other doctor told me it's going to damage my embryo and then I'm going to lose my embryo. And I said, we never have people that are not 100% trained and competent in doing this, doing a test on the embryo and doing your biopsy.
Perfect. So I'm a bit blown away by that. So I'm just going to let that just mull over me for a moment, because that's incredible figures. And I can see that pre-genetic testing is a huge factor in that. Well, something I'm really interested in is in terms of preconception care. So if somebody was coming to see you, and obviously we want to improve the quality of the egg and we want to improve the quality of the sperm, what sort of things do you work with them on? Because it's very limited here in the UK, unless they come to see someone like me.
I think it's physiologically very limited around the world. I'm a firm believer that there's not that much you can do to improve your egg. Your egg that has been inside of you since you were in utero in your mother. We know that when you're in utero, you have 20 million eggs. By the time you're born, you have 2 million eggs. By the time you go to your first menstrual cycle and the menarche, you're down to around 435,000 eggs. And those are the eggs that are going to be sitting there. And I don't think there's much to do to improve those eggs. There are certain medication protocols we can do, such as adding growth hormone to the protocol of medication that allows the 12 days of growth as it goes from a very immature egg until the lead follicle, which we go and capture, that allow it to grow nicely. But overall, I'm not a firm believer that there's much you can do to change. And then we have a lot of thought processes of people that want to take 3 months off to go and change the quality of their egg. Whereas for me, 3 months is a very, very big time for someone who is in their reproductive years, and you can have a significant decline. This is a topic that has come up many, many, many times, and I'm not sure where people found the idea that an egg could be improved. Clearly, for men, it's different. Sperm takes 72 to 90 days to regenerate, and we can have, in 3 months, completely new sperm that has changed. Now, spermatogenesis, I don't think changes that significantly, but we have clearly seen people that have used drugs or alcohol excessively, or smoking, or excessive exposure to heat like steam rooms and jacuzzis and saunas. When they emit those things from their lives, they're able to get much, much better sperm quality 3 months later, but not for women.
No, but in terms of more general health, so circulation to the uterus, do you encourage any forms of abdominal massage or chiropractic care?
Absolutely. So I am a firm believer. We recommend acupuncture. There's not really a massage technique that I'm aware of that brings more blood flow to the uterus. I think that anything that causes relaxation, such as massage, can be healthy for a person going through a stressful time, and being in a calm, serene situation in your mental and physical state is very important. However, I think that overall, the induction and bringing of blood flow to the uterus and the ovaries can help. I'm, again, not sure if it's going to change egg quality. Now, all of these things are different for the embryo transfer, okay? Because we make the embryos, we freeze them, and then we wait for the genetic testing results that generally take up to 14 days to get back. So there's no way to leave an embryo sitting there. And for that reason, it has to be frozen. Studies have also shown when you put an embryo back into a body that is stimulated with very high estrogen levels, there are more complication risks during the pregnancy than if you let the body come back to a much more normal state the following month. With that being said, there are lots of things that I recommend before the embryo goes back. Your weight should be in the normal range. The use of supplements that make your body ready and prepared, DHA, prenatal vitamins. These are all really important things. I think that making sure your uterine environment is as healthy as it could be, and your entire being mentally and physically as healthy as possible is really important for the transfer. But I don't think, again, sadly, that many of those things really make that drastic of a difference. I'm not saying zero, but that drastic of a difference when making the eggs. And I have concerns when people want to take 3 months to 6 months off to improve, and they're already like 39 years old.
It's a tricky one, isn't it? And I take your point about the quality and the count, but it's a huge factor, I think, with sperm. And of course, when you're not doing the pre-genetic testing, perhaps it becomes even more important in terms of the DNA fragmentation. And I know that's something in the UK that is still not being educated about, and still not necessarily, the embryos aren't tested in the UK unless there's a big issue. So I think that changes that process a little.
And by the way, I'm jealous because one of my colleagues, Dr. Cheryl Homa, who's an andrologist in London.
I know Cheryl.
She's amazing. And even though we have urologists that specialize in male fertility, I don't think that we have a caliber of person like that here in my city or in any other cities around the world. And London is very lucky to have her and someone that can evaluate sperm and how to improve significantly.
Yeah. So the sperm comet test that she developed is amazing, but still not widely used outside of London, which is a shame. So,
Right.
but that I did a podcast episode about sperm, and we mentioned Cheryl Homer a lot, but I am yet to have Cheryl on the podcast, but I will do. I will say it's your recommendation.
I can put a word in if you need it.
Absolutely. That's fantastic. Perfect. So that is hugely fascinating about the success rates and that pre-genetic testing. And in terms of your clientele then, so they're in where you're based in the US, and I guess you have people traveling from all over the US, not necessarily in California, that come to see you. Is that right?
Yeah, absolutely.
In our introduction, we were chatting about single women having IVF, single males with becoming parents, with the LGBTQ community as well. Is that a large part of your work that you're doing in terms of diversity? And
it is. We have a very diverse patient population here. We have a tremendous number of women who are single that want to just freeze their eggs. It's picking up a lot of momentum in the larger cities like Los Angeles and New York, where women who are really in the workforce and don't have time and don't want to deal, don't want to also cut themselves short down the line when it's time to have a child and when things have settled down and when they're ready. So egg freezing is huge. Sadly, in some countries, it's illegal to freeze your eggs. And honestly, I'm not sure what the status of egg freezing is in the UK, but here it's very, very accessible and doable.
It's available, but I think it's still quite new. And I did look at some figures, and it is increasing, but it's not a
That's
widely
great.
available area. I think if you're having chemotherapy or something like that, then that might be offered in terms of,
Right.
preserving.
We have the same thing here. There's also data out there that has shown that men who hit the age of 40, their sperm quality goes down significantly with increased chances of aneuploidy and abnormal chromosomal embryos. So we do have a significant number of men coming in just to freeze their sperm. We also have couples coming from around the world. One of my favorite couples coming to us from the UK is Tom Daly and Lance Black, who have started their family journey here in the US and honored me with helping them with their family. And they have a beautiful voice that explains to people the reasons and why to do things and do them the right way. And they have a beautiful, beautiful child as a result of surrogacy here in the United States. Actually, I was part of a series that Lance did along with Tom, which had to do with surrogacy. The BBC did it. I don't know if you ever got a chance to see it, but that was really well done. Really well done.
Yeah, and they've been really good advocates for it, and about that. I think they've done a really, really good job with that. They could have shied away and kept it all hidden, but they've used their position to be able to put that message forward, which I think is really, really beautiful. And I think
they're very open about it, and they have referred so many of their amazing friends to our clinic. So we're very appreciative of everything that they do to get the voice out and to let everyone know and educate everyone.
Yeah, it's, I could talk to you all night, but times I could be my bedtime soon. But it's so fascinating, and egg freezing is a big area. I had my babies. I had a miscarriage when I was 37, and then I had a baby at 38, and then one at 39. So I just have 16 months between my two. I thought my fertility might decline, but it didn't. So I feel very, very blessed, and that's why I work in this area. But it is increasing, isn't it, that age, we've already touched upon it, that when you're looking at people looking to get pregnant past the age of 35, then we've got different factors at play. Obviously you've got egg quality and so on. Would you say that's your mainstay of people that you're seeing, people over 35? Or
it used to be women that were knocking on 40, but now it's a wide range of people. The other day I had someone who was 24 years old doing a consultation. She's like, I've been trying for a year and I don't want to waste any more time. We also have older women that are ready to proceed, and many of them have froze their own eggs, many of them ready to use egg donation, many people even older that are willing to do egg donation, sperm donation, and even surrogacy. I mean, people are going to the extent of what they need to do to complete their family, and they're not letting a no because of their biology, hold their dreams back. And I think that's a really important message for people listening, that there are options. Sadly, some of these options are rather costly. That's the downside, because this is an industry that things are very costly, very involved, and to some extent, completely out of everyone's control. So we are very happy that people are using their knowledge, their education about fertility to do things that help them proceed down the line in a beautiful manner to get them that beautiful family.
Yeah. I was expecting to see a wall behind you with lots of pictures of babies on. I'm imagining there's too many to put on that wall. Is that right?
Yeah, I have a special location where I keep all the pictures. It's a drawer that I keep all the pictures that are sent to me and all the announcements and all the Halloween cards and holiday cards. But yeah, I didn't put it behind me.
No, it would. The certificates look great. I'll add to that. They look great.
Thank you.
So, is there anything else you particularly wanted to talk about in terms of, what's changing, new developments, or things that are going on within your practice?
Our practice is always at the top of the game in terms of what's available. So there's really nothing that I'm aware of that's available outside of my office that's not being done here. So I think that's one of the reasons why people travel to us from around the world. During this entire pandemic, we've been doing consultations by phone and by video and telemedicine. So it's opened the doors. I've been doing consultations with people around the entire world, which has been very helpful, I think, to them. People are traveling to us as well, even though they get here safely, kind of tuck away with an Airbnb or somewhere that's easy and do this. A lot of people are able to bring their laptops here and work from here, and their employer has no clue where they are or what they're doing. So that's actually allowed people to, the privilege of not having to be in an office and being able to work from anywhere has opened doors for many people. I would tell anyone who has even the slightest desire to learn more about their fertility to do so, to speak to a fertility specialist. It's never too early to discuss with someone what your options are or what you should or should not be doing.
Yeah. And I'm a massive advocate that unfortunately is not something that's hugely available here, because our system, because to get it funded, our system is if you're over 35, you have to wait 6 months before you can speak to anybody about it. And if you are under 35, you wait a year. Now, of course, you could go privately, but then that's it's not really encouraged. It's the sense that, well, I've got one free, so, we'll get into that system. And it's about opening people's eyes more and more to actually thinking about this sooner, isn't it?
Yep.
Not to get scared about it and not to work themselves up, but just to get a good idea of how things are.
Absolutely.
Yeah. So you need to be prepared. I nearly got on a soapbox then, but I will step off it now. And it's been an absolute pleasure to talk to you.
Thank you. Same here. I've really enjoyed it. Thank you so much.
It really has. And we'll have to have, there's so much more we can touch. We'll have to have part 2 in a little
That's right.
while.
Well, we keep people updated. I'm not sure if people in the UK are as on top of their social media, but the Dr. Shahin Ghadir page on Instagram has followers from around the world, and we try to keep people updated on the newest things, and we do a lot of Instagram lives. And we also have a YouTube channel, which is Fertility Talk by Dr. Ghadir. That one, all of these podcasts and Instagram lives are all put up there. People can go and look and learn about a lot of different things.
Sure. I'll share those in the show notes so people will get access to that. It's been an absolute pleasure. Enjoy the rest of your day.
Thank you. You as well. Speak soon. Bye-bye.
Bye-bye. Bye. You've been listening to the Fertility Rewire podcast with me, Kat Stevens. If you wanted to find any further details, then you can check out the website, fertilityrewire.com, or find me on Instagram or Facebook or Pinterest at Fertility Rewire.